Everyone, in this video, we're going to discuss admissions, discharges, and transfers. Welcome to CAS-RN, where I teach you about all things nursing. As stated previously, we're going to discuss how to do an admit into your facility, how to discharge from your facility, and then how to transfer either from one facility to another or from one floor to another. Before we get too far into this, it's important for you to understand the difference between inpatient and outpatient. So inpatient means that they're staying in the facility. So they're admitted to the hospital or facility overnight. This is going to be things like mom-baby, major surgeries, medical emergencies. And then outpatient is where they visit the facility, but they do not sleep inside of the facility, and they receive care and then they leave. So this is going to be things like x-rays, same-day surgery, IV therapy, or visits to the primary care provider. When you're doing an admission, it's so important to just walk in the room and introduce yourself. I cannot tell you how many times I have gone to the doctor with me or with a child or with somebody else, and the medical assistant or the nurse or whatever just starts doing things. They don't introduce themselves. They don't explain what's going on. And I absolutely hate that. It is very uncomfortable to have somebody touch your body without them even introducing themselves. So walk in, introduce yourselves, and identify the patient. Make sure that you're talking to the right patient. When you do identify your patient, you should definitely make sure that you're using 2 patient identifiers. So it can be name, date of birth, maybe the last 4 of their social, whatever it is that your facility uses, but make sure that you're using 2 of those, because you can't have people with the same name. You can't have people with the same birthday. So make sure that you're 100% positive that you have the right patient. Then introduce yourself, and then we want to start with our assessment. I like to start with the least invasive and then slowly move towards the most invasive. So of course, we're going to just talk to our patients, get their health history, get some vital signs, get their medications, and then we're going to do our head-to-toe assessment. And this is really important because this is our baseline assessment. This helps us know where our patient was at when they got there so that we can compare that to where they are when they leave. We're going to want to orient our patient to the unit or to the room that they're in. We also want to create a plan of care. So this is the plan that we're going to go through while they're in our care. We want to make sure that we've got orders from the provider. We can't do anything as nurses unless we have orders from a provider. And then this is also where your discharge planning begins, because the goal is always to help the patient be able to return home. And so our discharge planning really begins on admission. Then when the patient is ready to leave the facility, patient discharge is really important, because this is where you really become a patient advocate to make sure that your patient can leave the facility appropriately. So this means, are they able to take in nutrition? Are they voiding by themselves? Can they ambulate by themselves? So make sure that you are being an advocate for your patient and that you're being a good nurse upon discharge. I have received patients from facilities where they really were not appropriate to come to the floor that they were on or to the new facility where I was working, and they really shouldn't have been discharged. So this is where, as a nurse, you can stand up and say, you know what, I don't think that these guys are ready to leave yet. Then we're going to review that plan of care, make sure that we've done the things that we said we were going to do, or if not, why that changed. We want to help them know about any follow-up appointments that they may have. And then we want to give them a list of medications and educate them on what they need to be doing with those medications, when they need to be taking them, or any other additional education that they may need to know. Say, for example, they had a new ostomy while they were in the hospital because they had some bowel obstructions. You need to make sure that you educate your patient properly on how to take care of that ostomy when they go home, because ostomies are really challenging in a lot of ways. And if you just send that patient out the door, then they're not going to know how to take care of that, and they're just going to end up back in the hospital. I actually had a situation like this where I was working in home health, and I had a patient who was a Spanish speaker, and she was sent home with little to no education and no supplies. The nurse from the hospital sent her home with a urostomy bag, which is for urine. It's not for an ostomy. And so this poor patient was very confused, ended up with a lot of problems. The ostomy site ended up getting infected. She ended up back in the ER, and it was very, very frustrating. And there was a lot of lack of communication, and I had a hard time getting a hold of the providers. So just don't be that nurse. And then, of course, whenever we have a patient leave, part of that education is that we want to give them a discharge or an order summary when they leave. This should include their medications, the things that you were actively doing while they were in the hospital, and then what they need to do, as well as some, if they have like dressing changes or anything like that, that they know how to do that. Now, there's a couple of situations that a patient may choose to leave before they're actually discharged. There's two. We've got an AMA, which is against medical advice, and an LWBS, which is leaving without being seen. So the AMA this is when the patient knows that their provider doesn't want them to leave, and we'd prefer that they stay for additional treatment, but the patient doesn't want to leave. And it is your responsibility to respect the rights of that person. If they refuse assessment, if they refuse treatment, then it could be considered battery and assault if you do that against their will. So have them sign a form that states that they understand that they're leaving against medical advice and that they understand the risks associated with leaving the facility. If they refuse to sign or just leave without signing, just make sure to document everything that happened, and this will protect you in the long run. And then the leaving without being seen is more commonly in an emergency department where somebody would be coming in to get treatment and then they decide it's taking too long, or they leave for whatever reason, and they leave without actually seeing the provider after being placed in a room. So in this situation, again, you would just want to make sure that you're documenting everything that happened to the best of your knowledge. Now, patient transfer, this can be moving them from one unit to another or from one facility to another. And again, just like with the discharges, this is very, very similar to a discharge, but you want to make sure that it's appropriate for that patient. So let's say you've got a patient who's in ICU and you're transferring them to a step down med surg. Make sure that that's appropriate, that they aren't having any significant needs that can only be met in ICU, or you also might be having somebody from med surg that needs to be transferred from ICU into the ICU because they've become more critical. So make sure it's appropriate. And then there are lots of different types of transfers that are going to be done. They can go from, again, one floor to another. They can go from one unit to another. So maybe they're going to like a SNF from a hospital. And then when you're doing that, you want to make sure that you have a transportation method lined up. If it's just within the hospital, then it's really easy to just take them in the bed. If they're going to another facility like a SNF or a long-term facility, then you want to make sure that how they're going to get there. Because let's say they're an elderly patient and they've decided that they need to go to a SNF or they need to go to long-term care, then how are they going to get there? Now, frequently, a lot of SNFs and long-term care facilities will come and pick up their patients, but that are transferring to them. But just be aware of that so that you can help them, because of maybe it's a little old man and his poor little wife doesn't have the ability or the strength to get him from one facility to the next. Make sure that you help them out in knowing how to do that. And then giving report. I do have another video on how to give a good report, but I just wanted to share some experiences. I've had some bad reports and transfers from other facilities given to me. And I had one nurse who called to give me a report and told me a couple things like the name of the patient and their date of birth and what they were in the hospital for, which is great. That's a great way to start. But then rather than giving me a good report, they said, okay, how about you just run me through your list of questions and I'll just answer them. That's not giving a good report, and it's not my job to suck out that information from a nurse. It's the nurse's job to give me that good report, because I don't know this patient and I don't know what's going on with them, and I need that nurse to tell me what I need to know. And of course, always ask questions to follow up and make sure that you have the information that you need, but don't be a nurse that just says, just tell me what you want. Then I've also had nurses tell me like all IVs have been pulled. And then when I go in to do my assessment, I have found IVs on my patients. So again, like I've said, don't be that nurse. Give a good report and help the nurse who is assuming care do their job better and easier. So just a quick review here. Admissions are when you're going to be bringing a patient into your hospital. It's really important to introduce yourself and make sure that you're identifying your patient correctly and that you orient them and explain to them what's going on, and make sure you get a really good baseline assessment. Discharge is when they're going to be either leaving your floor or leaving your facility, and you need to make sure that the patient has the tools and the things necessary in order to be successful after discharge. Transferring also Very similar again to those discharges, but they could be going to another floor or to another facility. Make sure that you give a good report so that that patient and nurse can both be successful in their care. Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.